Hey there, this is Joseph Pate, better known as Medicare Joe. Again, back with our Medicare Basics series, and this one's a good one. We're going to talk about Medicare Advantage versus Medicare Supplement. This is quite literally the first decision that you need to make when you're getting onto Medicare, and a lot of people don't know that these are two completely different options. So when you get onto Medicare, you can either go the original Medicare with a Medicare Supplement route, or you can choose Medicare Advantage. And in our video here today, I'm going to supply you with what we supply all of our clients with, which is our 2 Roads to Medicare worksheet. We're going to walk through that on this video so you can really get a deep understanding of how the two compare to figure out which one might be a better fit for you. So in our prior Medicare Basics videos, we talked about Part A, we talked about Part B, and if you haven't seen those, you can go rewatch how Part A and Part B is covered. But the main idea of Part A and Part B is that it does not cover you entirely. There are gaps in coverage. So the reason that Medicare Supplement versus Medicare Advantage is your first real decision to make when getting onto Medicare is we need to figure out how we're going to make our coverage 100%. And that's by either going again with Medicare Supplement or Medicare Advantage. So I'm going to take the sheet up here and pull it up, but we're going to dive into the Medicare Supplement route first so we can really get a deep understanding of how that actually works with your original Medicare. So if you look here on the left side of this sheet, you'll have your Part A. Again, that's typically free to folks. You're not going to have to pay a premium there. Your Part B, the standard premium to date this video is $185. But if you have a income related adjustment, which we'll talk about later on here in another video, it could be a little bit higher than that based on what your income is. But in summary, Part A and Part B, again, that's going to join together. That's going to cover you at 80% for your major medical. So what you're doing here is with the Medicare Supplement, that is covering the 20% gap in coverage that your Medicare A and B does not cover. And you're going to pay a premium for that Medicare Supplement plan. Now, the Medicare Supplements, the premiums, they differ state to state, even zip code to zip code. But for a ballpark, you're usually between like $100 to $150 a month for a Medicare Supplement plan. And then the Medicare Supplement plan and your Part A and Part B would join together, giving you coverage at 100%. So what you're doing here, in essence, is you are paying an additional premium on top of your Medicare payment to avoid having to pay any medical bills. In theory, you're paying a fixed monthly cost, so you don't have to worry about any of the variable costs of healthcare throughout the year. Now, there's some highlights behind this left side of Medicare being, original Medicare with the supplement, and that is that there's no network, there's no referrals, so it's a very flexible type of healthcare where you're not really confined when it comes to the network. Now, with this left side, you'll note here on this sheet, dental, vision, hearing is not included with original Medicare, but there are ways that you can purchase additional benefits there to have dental, vision, and hearing with this left side. And then lastly, with original Medicare and a supplement, if you want drug coverage, you're going to need to purchase a standalone drug plan. And typically those range from $10 to $40 depending on how much medications you're actually taking. So again, the left side, in summary, think of this as like a strong foundational healthcare plan with very few surprises that could come up throughout the year, but it's going to come in at a much higher premium than what Medicare is you're paying for additional healthcare. Now, on the right side here, you'll see Medicare Advantage. So you can't have both of these options. You need to pick one or the other because they just don't work together. They're not functioning that way. What Medicare Advantage does is it takes your A, your B, and your Part D, and it's going to group it all into one plan, Medicare Advantage or Part C. And your only premium that you actually will pay here is going to be your Medicare premium, which again is that $185 for Part B. So in essence, you have Medicare A and B. You're just not insured by Medicare A and B when you're on this side. You qualify for Medicare, but you're picking a private healthcare plan to take the place of Medicare insuring you. So when you do that, what happens is you will have a standard list of copays and benefits that private insurance carrier is going to offer you. I've listed some here. Again, this isn't a specific plan. This is just for educational purposes, but a primary care doctor may be free, specialist 40, emergency room 20. If you stayed in the hospital overnight, you're looking at about $400 a night for, let's say, 4 to 5 nights in this example. So again, every Medicare Advantage plan has different benefits, so these numbers may change a bit, but in theory, it's going to work very similar to maybe how you had healthcare through an employer or through the marketplace if you weren't on any subsidies, where you're paying a copay, so a variable cost, as you use the plan. If you notice here, a hospital ride or something we talk about in our office every day, that's an additional $40 a month typically that you can pay extra to have the hospital copay covered, so you don't have to cover it. Now with Medicare Advantage, it has a lot of perks. It comes with dental, vision, and hearing. It comes with, the silver sneakers, gym membership a lot of times. But some of the exposures are you're going to be working within a network of doctors. So you're going to remember that your doctor has to take the plan typically to be covered by the actual plan benefits. And then you're going to have usually what's called a maximum out-of-pocket limit, which is the most that you can pay in a calendar year if you were to get sick. So with most plans, it ranges from $5,000 to $9,000, again, based on your state or zip code. And we can get exact quoting once we know that, but ultimately that is your exposure. So if you had a really bad year medically, that's the limit that you could hit. Every year you hit that max out of pocket. So just something to be mindful of, where Medicare, original Medicare with a supplement, you're paying that fixed cost every month to avoid variable, factors. With Medicare Advantage, you're kind of gambling and betting on yourself, saying, well, I feel like I'm going to be healthier than what the premium I would have paid out for a supplement would have been, and I'm going to take the chances with paying those variable costs as I use the plan in copays. One of the most common questions I get when we walk through this Roads Worksheet is there one that's better than the other? And that's really a tough question to answer because Medicare is not a one-size-fits-all option. So first thing that comes to mind is budget. So if a Medicare supplement is out of budget, that's usually the first answer, that the Medicare Advantage route was the option. But if budget's aside and you're thinking in terms of I can spend the extra premium for a supplement plan, it then comes down to, do you want to have peace of mind knowing you're paying a fixed monthly premium to avoid paying medical bills? So in terms of better, that's kind of a subjective term because it's going to be different for every single person as they get onto Medicare to figure out. Each has their pros, each has their cons, and this Roads Worksheet, when it's detailed in your area, you really get a good idea of how the costs compare. The second question we get a lot is, can I switch later on? So for example, if I start with Medicare Advantage, can I then go to original Medicare as I get ill in my later years? And the answer to that is most of the times no, because getting onto the original Medicare with the supplement side, you have to health qualify after your initial Medicare enrollment. So that can kind of leave some people on the sidelines. If you can't health qualify to change after your enrollment, let's say 3 or 4 years down the road when you get an illness, you may be stuck on Medicare Advantage for life and having to pay those copays. So that's something to be mindful of when you are getting enrolled. And then the last thing that I just want to touch on here as a question, we hear a lot, and why people get confused, they hear that Medicare Advantage is a zero cost plan. And though Medicare Advantage doesn't have an additional premium that you pay for your Medicare, you still pay the Part B premium of $185. It does have a trade-off there where you're paying costs as you use the plan. So again, it's a zero premium plan in terms of being additional payment on top of your Medicare, but you're gonna have costs as you use it. So it's not a zero, a free plan like we see a lot of advertisements. Persuading people into it. Again, both options are of value to the right fit, It's just a matter of how you want your healthcare to work. So that sums up our 2 roads to Medicare, Medicare Supplement versus Medicare Advantage basic video. And if you look in the description below, you can download your free 2 roads to Medicare worksheet to follow along, fill it out for you or a loved one. And if you need more assistance than that, our team is happy to take a call and walk you through exact quotes within your area. We're licensed in all 50 states here. And please, if you enjoyed this video, give us a thumbs up, hit that like button. That means the world to us. It means we're doing a good job putting good content out there. And if you or a loved one you know may be in need of Medicare, drop some comments below if you have any questions. Lastly, if you'd like to be notified as we post new Medicare videos like this, hit that red subscribe button, and that'll notify you whenever we post any new to YouTube videos. Thank you for watching. Again, Medicare Joe with our Medicare Basics series.